or even all of them. You could have all of these criteria. It either is or it isn't. You're building a conceptual framework, because the trick is, when you get through reading this chapter on psychological disorders, you want to be able to think and reason with what you're learning. Only by reflecting and having the internal dialogue, what do I already know, what do I not know, getting the repetition, do you get it in the prefrontal, I guess that's to say, prefrontal cortex, that part of the brain where you're able to think about it and use it. If you memorize the definitions, or you just read that and keep going, even if you understood it, it goes here, you can get to it, you can't think with it. That's all we're doing. So now we're going to do one other little quick thing right here. We're going to keep going, and when we look down through here, it says, in contrast, anxiety disorders involve fears that are uncontrollable. Can't control it. If you can't control it, how does this relate? Always, how does it relate back? It's personally distressful over a long period of time. Okay? If I can control it, it's not over a long period of time. I'm not talking to you. I'm having an internal dialogue in my head. I am getting the information here. So as I read that, it's uncontrollable, disproportionate to the actual danger. So the actual, you know, I become very anxious to get up and give a presentation, like maybe talking to this iPhone here that's videotaping me. But there's no danger. I'm not going to get hurt. Nobody's going to do anything. Nobody's going to say much. And if they do, so what? So, in contrast, so it's disproportionate to the actual danger or disruptive to ordinary life. So right now, I need to stop and reflect, because this is something that I read, understand. There was nothing hard to understand right there. It's just going to disappear. The dendrites are going to go. They were building. They're going to go. I need re-exposure. What do I already know about this? And so when I stop and I look back, and it's uncontrollable. I just did that a second ago. Given the presentation, it's not always long-term or what have you. It's disproportionate and to the actual danger. There actually is no danger. Well, why is my body responding with fear if there's no danger? And then it affects the functioning in my life. Now I'm going back over that and saying it and having a conversation so that I can get it into my organized pattern of my mind map. In my mind map right here, anxiety disorder, it told me that there were several, or gave me several examples. And so, actual danger, my functioning, does it affect my functioning? And the first one, I'm having trouble remembering what the first one is. Because one of the questions you always ask yourself, and you find out, is did you actually get that one? And I shouldn't be putting this on the map till I know what those three things were. And as I look back down, it just came to me. Uncontrollable, so it's also uncontrollable. And so, actual danger, you know, I'm going to draw, this is a line, this is me. I am actually in danger. And so all of these things fit right here. It's uncontrollable, actual danger. It's whatever I was doing at this point, this line showed up, it's affecting my functioning. That's a psychological disorder. But is it over a long period of time? Is it deviant behavior for me to be upset because a line just appeared in front of me? Does it affect functioning? Yes, it affects functioning. So what makes the difference right here? Anxiety disorders involve those things. They feature motor tension, jumpiness, hypertension, dizziness, racing heart, apprehension, expectations, and thoughts. So there's going to be 5 kinds of disorders. And there are going to be 5 types of anxiety disorders. If you look in your book, you're going to see that you've got general, panic, phobia, obsessive compulsive, and post-traumatic. And at this point, I stop and think, what do I know about those particular disorders? Well, generalized anxiety disorder, which is going to talk about down here, see, so far it's just talking in general about what is normal and what is abnormal behavior. Now it's going to start talking about a specific one called generalized anxiety disorder. When it starts talking about that, I need to be able to relate it back to this, separate it from this, and how does it relate to that? It doesn't take very long. I'm doing more talking about it than it actually takes to do it. You just do it. And as my psychiatrist over here, this is how she has to be able to think. If she's what we call an adaptive learner, and she's learned her stuff well enough, she knows how to think through this, and she can make decisions and solve problems because she learned it in a way that went up here. If she's not adaptive, she's procedural. She knows a bunch of information, but here I come, I've got anxiety. Well, what were you anxious about? And I tell her what I was anxious about, and she has to make the distinction. Is this normal and abnormal? And if it is abnormal, does it fit under here to make sure that it actually is abnormal? It's got to fit within the definition. It's got to fit there. And so that's what she does. And then she's headed for generalized anxiety disorder. I do not go anywhere at this point until I make sure that I know this, that normal anxiety is just having anxiety, like a police car coming up behind me and I get anxious and all that sort of thing. And abnormal behavior is where it's uncontrollable. It keeps me from functioning the way I need to function. And I'm actually in danger. If I look over here, does it fit any of these things? Well, a line coming up on me isn't a problem. But if I get anxious every time I see a dog, and I can't be in a room where a dog is, and over a long period of time, and it keeps me from functioning, and if a dog is around, and it's atypical behavior, because most people don't get scared and anxious and go into all of this stuff just because they've got a phobia. And so one of the anxiety disorders was phobic disorder. I just described one. I come in, dog walking down the street in front of me, I frozen in place, I couldn't move, I couldn't think. Well, does this generally happen? Does this go on and on? Is it normal, abnormal? You know, people can have things happen, you know, it may just startle me for a second. She's got to make the decision. She can't make those decisions if she didn't learn it, so it's up here. So all we're doing is just simply saying, if you want to read and memorize, you're going to forget it all. But if you want to spend the extra second reflecting and thinking about what you're doing, having the internal conversation that's going on, mapping it, seeing how it is organized, so that you're learning the facts, building a framework of facts, you're learning within this conceptual framework, and you're organizing it so you can retrieve it and think with it later. That's how my psychiatrist is going to be able to think with it later. Then you're on the right track. Now means turn it on.